Okay. Good morning, everyone. My name is John Federico. I am the Director of Advancement for Senior Community Services, and I provide technical support for the PA Medi program so that we can assemble videos like this one to record presentations and make them available on demand to people in Delaware County who need advice and guidance in how to deal with Medicare and its various parts. Today, we're joined by one of our longtime volunteer presenters and counselors, Donald Soslow. Donald is here to speak about Medicare 101. So please welcome Donald Soslow.
Thank you, John. Again, my name is Don Soslow. I've been a counselor with PA Medi for about 6 or 7 years. We were formerly known as a prize, and the name has been changed, but it is the same organization. We are now PA-MEDI. And this morning I am going to provide a overview, a broad overview of Medicare. And before I begin, since it's a broad overview, I recommend that if anyone who is witnessing or listening to this presentation needs more information, that they should contact PA Medi and sign up for a individual counseling session where we can delve into your specific issues and go into much more detail about some of these complicated issues. So with that, we are going to begin. Next slide, please, John. So who's PA Medi? Well, we're affiliated with the State Health Insurance Assistance Program, known as SHIP. We have offices in 54 of the 67 counties in Pennsylvania. We are funded by the federal government and also the state of Pennsylvania. Next, please. And we are an organization, one of the few that can provide free, unbiased information to our clients. We have no affiliation with insurance companies, so there is nothing for us to gain by providing this information to our clients. We are going to talk about issues such as how does Medicare work, the prescription drug and health plan comparisons that we do, Medicare supplement information that we can provide. We can discuss the Medicare cost-sharing programs, your Medicare rights, any billing concerns you may have, or complaints about medical care and treatment. We're able to discuss all of these topics. Next, please. So this slide, if you can raise that slide just a bit, John, so we can see the bottom. Thank you. Well, even a little more if possible. This is a critical slide in that Medicare offers two distinct options. The column on the left is called Original Medicare, and I'll discuss that in more detail in a moment. The column on the right is Medicare Advantage. When you first join Medicare, that will be the first decision you make, whether to go with Original Medicare or a Medicare Advantage plan. So let's talk in a little more detail about each of them. Original Medicare, you have a red, white, and blue card from the government. Contains Part A, which is hospital insurance, and Part B, which is medical insurance. Together, A and B cover about 80% of your medical costs. Many people that go with Original Medicare who want to make up for that missing 20% purchase what is called a Medigap or Medicare supplement plan. Medigap equals Medicare supplement, same thing, different terminology. And the third piece of Original Medicare is a standalone prescription drug plan known as Part D. So those three pieces, A and B, Part D drug plan, and a supplement constitute Original Medicare. The other option is called Medicare Advantage. With Medicare Advantage, we take A and B and roll together with Part D drug plan and come up with Medicare Advantage or Part C. So Part C, or Medicare Advantage, contains A, B, and D. And there's a couple flavors that I'll discuss. HMO and PPO are two of those flavors. HMO stands for Health Maintenance Organization. And what that means is each Medicare Advantage plan will have a list of doctors and hospitals that you're expected to use. If you do not use those doctors and hospitals, you don't receive a benefit. Most of these plans also provide what is called PPO options. That is Preferred Provider Organization. In that case, they still have a network of hospitals and doctors, but for an increased cost or a lesser benefit, you can step outside that network. So there are the two distinct alternatives. And as we go through the rest of the presentation, we'll be going into more detail about each of them. Next, please. So let's start with Part A. What does Part A cover? It's hospital insurance. Inpatient care, if you go in the hospital, if you have skilled nursing, home care, rehabilitation care after a hospital stay, hospice, home health care, all of that is covered under Part A. Next. How do I enroll in Part A? Well, you're eligible in most cases at your 65th birthday. You do not have to be retired to receive Part A. You can still be working. If you're on Social Security when you turn 65, you'll automatically be signed up for Part A. If not, you can apply at a Social Security office, or you can go online at www.ssa.gov. You are eligible to apply 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after you turn 65. Again, if you're on Social Security, for any reason, you'll automatically receive your red, white, and blue Medicare card. Next, please. And that's just a picture of what the card looks like. It has your name, it has your Medicare number and your start date for Part A and Part B. On the right side is a booklet, Medicare and You, that you can get from Medicare. When you sign up, you'll receive that. You can also go to a website called medicare.gov and ask that a copy of this booklet be sent. Next, please. What does Part A cost? Well, the premium is based on your employment history. If you've worked 40 quarters, that's 10 years or more in your lifetime, there is no premium. That's all taken care of. And most people fall into this category. If you've not worked 40 quarters, then you will pay a premium, and it can be up to $499 per month in 2022. But it's a sliding scale, and it's based on the number of quarters worked. Again, most recipients of Medicare fall into the first category, and Part A is premium free. Next, please. Part A has a hospital deductible, so the first $1,556 will be the responsibility of the Medicare client, and that covers a 60-day benefit period. Once you're in 60 days, you can start a second period with the same deductible. It covers skilled nursing, rehab. If you've stayed in the hospital as an inpatient for 3 days, you're eligible for skilled nursing and rehab. And from days 1 to 20, zero copay. After 21 to 100, there's $194.50 a day copay. Again, it's important here, this service will only be covered if you stay 3 days as an inpatient in a hospital. So if you go to an emergency room, for instance, and spend 2 nights, that is not sufficient. You actually have to be admitted to the hospital before this benefit will kick in. Next, please. Now let's talk a little bit about Part B. What does it cover? Part B is medical insurance, and it covers 80% of medical services. What are medical services? They can be a doctor visit, an outpatient service, a test, an x-ray, ambulance services, medical equipment. There's quite a long list of benefits that are available to someone on Medicare. Next, please. How do I enroll in Part B? Again, when you're 65, you can, if you're not on Social Security, you can go to a Social Security office, call a Social Security office, or go to the Social Security website at ssa.gov. Again, you can apply 3 months prior to your 65th birthday, the month you turn 65, and 3 months after you turn 65. If you are receiving Social Security, you will automatically be enrolled in Part B. Next. Now, more so today than ever, individuals are working beyond their 65th birthday. And if you are employed at the time you turn 65, you do not have to enroll in Part B if you work for an employer with 20 or more employees. So the coverage that you receive from your employer is called creditable coverage. That means whenever you finally leave your employer coverage, you will have 8 months to sign up for Part B without any penalty. Next, please. The premium for Part B for 2022 is $170.10 a month. If, as a single person, your income is over $91,000 a year, or as a couple, $182,000 a year, you may be paying more for your Part B. Your Part B premium can be deducted from your Social Security payment if you're receiving Social Security. Otherwise, Medicare will bill you on a quarterly basis. Next, please. Part B has, in the year 2022, a $233 yearly deductible. So no matter what plan you're on, original or Medicare Advantage, the first $233 a year of services will be out-of-pocket costs. Once you reach that threshold, Part B will cover 80% of the cost. And as I mentioned earlier, the 20% can be covered by a Medigap policy, if you so choose. Next, please. There are a number of programs available in the state of Pennsylvania to assist with the payment of Medicare premiums. This is the first of a number of them that I will mention throughout the presentation. On this particular program, the Medicare Savings Program, assists with the payment of the Part B premium of $170.10 a year. If you are eligible for Medicare A and B, you can apply. If you're also on Medicaid, you will automatically receive this benefit. But the chart there in front of you shows the 3 different levels of assistance that you can get. And the assistance is based on 2 factors. It's based on income and it's based on assets. And for each level, the benefits decrease as you go down. I'm not going to read off all the numbers. Again, this is a reason to have a counseling session, an individual counseling session, so you can dive down into some of these details to see if you may be eligible for some of this assistance. Next, please. So how do I apply? Well, we as counselors can assist you in applying. You can complete a paper application. We can do it online at www.compass.state.pa.us, or we can go directly to the Social Security website and apply. Next, please. So that's an overview of A and B and some of the assistance that you can get. Now we're going to talk about supplemental insurance or Medigap plans. Again, if you're with original Medicare, A and B will take care of 80% of your medical costs. And now we're going to talk about how do we deal with the missing 20%. And we deal with it by purchasing what is called a Medicare supplement or Medigap plan. Next. And the Medigap plan basically covers almost all of the copays and deductibles not covered by A and B. The Medigap plans are provided by private insurance companies, not the government. And this is very important. There may be 20 or 30 companies in a given county, such as Delaware County, that will provide a Medigap policy. And by law, federal law, no matter what plan you buy, say you buy a plan A, and I'll talk more detail about the individual plans in a moment, but if you buy a plan A from any insurance company, the coverage by law will be exactly the same, no matter who you buy it from. What will vary considerably will be the premiums. So Medigap plan types run by letters A through N, and I'm going to talk about that in a little more detail in a moment. Next, please. This may be one of the most important things I say in this presentation today. When you turn 65, you have a 6-month period following your enrollment in Part B when you can sign up for a Medigap policy, and the insurance company guarantees you acceptance, no matter what medical pre-existing conditions you may have. So no matter what your health is, you have a 6-month period following signing up for Part B when you cannot be turned down. This is very important. Next, please. This is a chart of the various types of Medigap policies that are available. And there's 2 sections to the chart. The left side shows you A through N that are plans that are available now to all applicants. And on the right side, you C and F. And these are plans that were available to everyone in the past, but are not eligible to any new Medicare recipients starting January 1, 2020. And the chart shows what is covered, and I'm not going to go into great detail. Again, this is a subject that would be covered during the counseling session, where we can choose the plan that would be best for any individual client. Next, please. So most of the plans cover the Part A coinsurance and hospital costs, the Part B coinsurance or co-payment, also pays for the first 3 pints of blood, hospice care, skilled nursing facility care, and most of them cover approximately 80% of the cost of an emergency room if you are traveling overseas. Next, please. If you sign up for a Medicare plan, you would get a card that looks like this. It would have your name, your policy number. It would have the letter A through N. In this case, it's G. When you go to the hospital, see a doctor for the first time, you would show this card. They would put that information into their computer system, and that would probably be the only time you would have to show this card. Next, please. As I mentioned, the plan C and F cannot be sold to new Medicare beneficiaries. And who is considered newly eligible? Anyone who attained age 65 on or after January 1, 2020, or becomes eligible for Medicare due to age, disability, or end-stage renal disease on or after January 1, 2020. Next, please. There are replacement plans for the C and F that are quite good. There is a high deductible plan G that replaces the high deductible plan F. Again, lots of detail on each of these Medicare subjects that you need to understand, and that's why I keep repeating that an individual counseling session is really key. Next, please. Now, this is very important. I mentioned that earlier that you have 6 months after you get your Part B to sign up for a Medigap or supplemental policy, and it doesn't matter what pre-existing conditions you may have. Once you go beyond that 6 months, or you want to change from one supplemental policy to another, you are going to be subject to what is called underwriting. What is underwriting? Underwriting is a process that the insurance company employs. They would give you a medical questionnaire to fill out. And depending on the answers you give to that medical questionnaire, the insurance company has the right to accept you, to turn you down, or accept you at a higher premium. In other words, pre-existing conditions are no longer guaranteed if you're changing plans or if you go beyond the 6-month period that I've talked about. Next, please. How do I enroll in a Medigap plan? Well, with Medigap plans, you need to call the insurance companies directly. But what we, PA Medi, can do for you is we can provide you with the company names and phone numbers. You just make a call and you can enroll on the phone. And we have the ability to look at all companies providing Medigap policies in Delaware County in this case. Again, the coverage is going to be the same. So the only variable is going to be the premium cost. And so we will provide you with 3 or 4 of names of low-cost providers. And we recommend you go with one of the low-cost providers. There's no benefit in paying more to an insurance company because the benefits, again, are the same. Next, please. That takes care of Medicare supplements. Now, the third piece of original Medicare, A and B being the first piece, supplement being the second. The third piece is a standalone Part D prescription drug plan. Next, please. Of course, Part D prescription drug plan helps with prescription drugs, but does not cover over-the-counter drugs. Most of the drug plans have copays and deductibles. You only need a standalone drug plan if you're going with original Medicare. In most cases, Medicare Advantage plans already have Medicare prescription drug coverage embedded in the plan. Next, please. So there's a number of private insurance companies that provide Part D plans. You don't need a Part D if you're getting your prescription drugs from veterans benefits, or you're eligible for an assistance program called PACE or PACENet that we'll talk about a little later in this presentation. You may be getting your prescription drug coverage from your employer or from the federal employee health benefit drug plan. But if you do need a Part D plan, next, we will be able to help you choose one. All of the plans can be accessed through a website called Medicare.gov, G-O-V. All of that information is on that website. If you sit down with a counselor, that's the website they're going to use to help you choose a Part D drug plan. They're all the plans will have a monthly premium. Most will have an annual deductible. There'll be co-pays each time you purchase a prescription. And then there's a coverage gap and donut hole. I'll talk about that in a moment. Next, please. So when we choose a plan, the cost of the plan for the year is going to be dependent on the number of drugs and the type of drugs that you take. And the website, Medicare.gov, is able to calculate the cost of these drugs, include the premium, and come up with one number. And again, we recommend that we go with one of the low-cost providers. As long as all of a client's drugs are covered, we'll have a premium plus drug cost number, and we will provide data on the lowest 3 or 4 providers. And that's how we really choose a drug plan, and you can sign up for a drug plan right online. Now, I mentioned something called the coverage gap. So I'm going to use an example here of Mrs. Smith. She purchased a drug plan on January 1st of 2022, and she starts using that drug plan to acquire the prescription drugs she needs. So the first, in this case, she has a $480 deductible. So the first $480 are out-of-pocket costs for her. Once she meets the deductible, we go to the second column, and she pays a co-payment for her drugs. That co-payment is going to vary by company, but she will know that ahead of time. And she will continue to pay the co-pays until she reaches an out-of-pocket cost plus the cost of the drugs of $4,430. That's the number for 2022. Once she reaches that number, she enters what is called the coverage gap or donut hole. It used to be that when an individual reached the donut hole, they paid the full cost of the prescription while in that donut hole. No longer the case. In 2022, whether for a brand name or a generic, the individual will pay 25% of the cost of the drug while in the coverage gap. You will remain in the coverage gap until you reach the out-of-pocket plus drug cost of $7,050. Once you reach that level, you then are subject to what is called catastrophic coverage, where you pay 5% or $395 for a generic or $985 for a brand name, whichever is greater. Many people never reach the coverage gap, and many people never reach catastrophic coverage, but those categories are available to assist people with the payment of these costs. Next, please. This is just a sample of a prescription drug plan card that you would receive. The first time you would go to your pharmacy, you would give them this card. They would enter the information into their computer system, and then that information would be available for the remainder of the year. Next, please. This is another assistance program. Earlier, we talked about assistance with the Part B premium. This is extra help, or LIS, low income subsidy. This is a plan that helps with drug costs. And you may be eligible for extra help if you have A and B, have a limited income and resources, or are also on Medicaid. You may be eligible if you're receiving the Medicare Savings Program benefits. That's the Part B plan that we talked about. Next. So this slide shows the income and resource being assets, limits for 2022. You can have a full subsidy, as this slide shows, and the next slide will be partial subsidy. But with a full subsidy, depending on whether you're a single or a couple, you have income limits, you have asset limits. Again, if you sit down with a counselor, we can go through this information in quite a bit of detail to see if you are eligible. Next, please. Now, if you are eligible for full extra help, you have no monthly premium for your drug plan, no annual deductible, no donut hole, and your copays can be as low as $1.35/$4 if you're on Medicaid, or $3.95, $9.85 if you're not. And the two numbers there, one representing generic drugs, and the second representing brand name drugs you're going to pay more for. And you have no copays for the rest of the year once you reach the $7,050 total of out-of-pocket costs. So a very substantial benefit if you're eligible for full extra help. Next, please. Now, a second level plan is a partial subsidy. And there are the numbers for singles and couples. Again, the levels are going to be higher. And of course, the benefits are going to be less. And we'll see those benefits on the next slide, please. So if you have a partial subsidy, you're going to get help paying your Part D premium. And that's going to be on a sliding scale depending on your income. Your annual deductible is going to be reduced substantially from $480 to $99. No donut hole. And the plan pays 15% copays for all drugs until out-of-pocket costs reach $7,050. So again, a good benefit, not as good as, of course, as the full extra help. Next, please. How do we apply for extra help? Again, we at PA Medi can help you. We can do that online at the Social Security website, ssa.gov. We can do a paper application. We can also call the Benefits Data Trust Organization, BDT, and they help with a lot of Medicare issues, a lot of the assistance programs. If you have questions, you can always call them at 800-866-1807. So a number of ways to get assistance: PA Medi, Benefit Trust, online, lots of information out there. Next, please. Now, a third benefit program, this one called PACE and PACEnet. This set of programs, again, available to help with the Part D prescription drug plans. To be eligible, you need to be 65 years of age or older, be a resident of Pennsylvania for 90 days, and not receiving benefits under Medicaid. PACE and PACEnet only have income guidelines, no asset or resource guidelines, just income guidelines. And on the next slide, we'll see those guidelines. Next, please. So as a single person, you can see the income levels you must be below. As a married couple, the same. So This is for PACE. So PACE has one level of benefits and PACEnet a second. So with PACE, if you're eligible, you will pay $6 for a generic, $9 for a brand name. That may, in most cases, be a lot cheaper than the cost if you just pay with a Part D prescription drug plan. Next, if you're not eligible for PACE, you may be eligible for PACEnet. Again, the income is quite a bit higher, but the benefits are less. You'll be subject to a monthly deductible, an $8 copay for generics, $15 for brand names. Again, a counselor can assist you in determining whether you are eligible for these plans and then can assist you with applying. Next, please. So how do I apply? Again, an individual counselor can assist you with that. You can complete a paper application. You can call PACE directly at 800-225-7223. Again, you can call Benefits Data Trust, or you can email PACE at papace@magellanhealth.com, or you can go to the PACEnet website, www.pacecares.magellanhealth.com. Next, please. Okay, so we've covered original Medicare, A and B, Part D drug plan, supplemental assistance programs. And now we're going to talk about the other alternative to original Medicare, and that's called Medicare Advantage. Medicare Advantage plans, known as Part C, as I mentioned earlier, HMO, PPO versions having to do with networks of doctors and hospitals that you are expected to use if you are to receive benefits. Next, please. So let's talk a little bit more in more detail about Advantage. It's another choice in the Medicare world, covers the same services. You're still going to have Part A and B. You're going to pay the Part B premium. Most, again, have prescription drug coverage built into the plan. And some are going to have some additional benefits in the areas of hearing, vision, and dental that you will not find in original Medicare. Many of the plans will not have an additional premium, and they're called zero premium plans. There will be some that do have a fee. Next, please. So we talked about HMO and PPO. I'm not going to go into them again. The other managed care structure you should be familiar with are special needs plans, SNP. And you must be on both Medicare and Medicaid to be eligible for those plans. And many of those plans have some additional benefits beyond the standard Medicare Advantage plans. These plans are all provided by private insurance companies. Next, please. And these plans are going to include deductibles, copays, and coinsurances. Meaning every time you use a medical service, there'll be a cost associated with that service. The more services you use, the more it's going to cost you in a given year. You cannot have Medicare Advantage and a supplement plan. It's one or the other. You cannot have a separate Part D plan and Medicare Advantage. If you try to do that, you may lose your coverage. It's one or the other. Next, please. This is an example of a Medicare Advantage card. Your name and ID, the type of plan you can see down in the bottom right-hand corner. It says PPO. Medicare RX means you have drug coverage embedded in that Medicare Advantage plan. Again, first time you see a doctor or go to the hospital, you would show this card and this information would be entered into their computer systems. Next, please. So we've talked a great deal about original Medicare, a little bit about a Medicare Advantage. And now I'm going to go through this chart where we can see some of the advantages of each of the plans. So we're going to start with Medigap. So the Medigap plan is not subject to networks. So any hospital doctor that accepts Medicare, and that's almost all, will accept your Medigap. Covers most deductibles, copays, and coinsurance. No referrals necessary. As I mentioned, it's sold by plan type, A through N. If you want a drug plan, you must purchase one separately. You do not get extra benefits such as vision, dental, or hearing. It's readily accepted by doctors. If you're switching plans, you will be subject to underwriting, and you can be rejected because of pre-existing plans. You will be underwritten also if you do not sign up for a Medigap plan in the 6 months after you sign up for Part B. And premiums can be increased for lots of reasons. And I can assure you they will be increased over time. That's a Medigap policy. With Medicare Advantage, we've talked about there being networks, HMO, PPO, or SNP plans. So if you have doctors that you want to continue using once you go on Medicare, you need to make sure those doctors are part of the plan that you're signing up for. Most of the Medicare Advantage plans include a drug plan. There may be a monthly premium, they may not be. They all have copays and deductibles. Some may require a referral, although most today do not. The benefits are going to vary company to company, and we can help you look at the many Medicare Advantage plans that are available. You can switch Medicare Advantage plans very easily. You can do that during the open enrollment period each year, which runs from October 15th to December 7th, or during a special enrollment period, January, February, and March of the following year. So you have that flexibility of changing Medicare Advantage plans. There may be some extra benefits with these plans that are not available under original. Not all doctors are going to accept all Medicare Advantage plans, and there's a maximum out-of-pocket cost if you have a Medicare Advantage plan. And that number is going to vary, but typically is between $6,700 and $10,000. So there's lots to consider when making the decision, Medigap versus Medicare Advantage. If you start with Medicare Advantage and then you want to go back to Medigap, you may be subject to underwriting with the supplement, and you may not be able to get it. If you start with Medigap and you want to switch in the next year to Medicare Advantage, that's pretty straightforward, and you will not be subject to any restrictions. Next, please. This again is the chart that we started with, showing the original Medicare on the left column, Medicare Advantage in the right. We've covered most of this information in quite a bit of detail. So let us move on to the next slide, please. Now, if you need more information, if you need help, there's a number of ways to get that help. You can call PA Medi at 484-494-3769 to set up an individual counseling appointment. Or if you want a copy of these slides, you can call that number and ask that the slides be sent out to you. There's a great deal of Medicare information available at the Medicare website, www.medicare.gov. You can call Medicare directly at 800-633-4227. You can also go to the Social Security Administration website where there's quite a bit of information. That is www.ssa.gov. And next, please. Again, we've talked about the PA Medi counselor program, the phone number. On this slide, you can also see an email address to contact PA Medi. That is DECLO, Delco PA Medi at scs-delco.org. And there's also a PA Medi website, www.delcomedicareprogram.org. Next, please. Unfortunately, today I can't answer your questions, but certainly if you have questions, please contact one of the resources that I've covered on the previous slides. And I want to thank you for your attendance. Also remind you that there are many other PA Medi presentations available online. And again, you can get that information by calling the PA Medi phone number. Again, thank you for your time.